From an overall standpoint, SIBO and SIFO is something that is going to be more and more and more prevalent in our society. So we have to make sure that as individuals, I'm trying to give you as many tools as you can to work on fixing it and work on treating it. Okay, now I don't typically give like protocols out to, hey, just treat this, but this one in particular, I'm just going to tell you doses. All right, everybody, welcome to another episode of the Jacque Show. Today, we're going to be talking about a topic that I think is getting more and more traction, and something that we've noticed over the past couple of years or so is we've had these trends in American society where we're dealing with a lot more bowel issues. And so the most common things in terms of diagnosis is going to be like an IBS or an IBD, right? So irritable bowel syndrome or irritable bowel disease. Disease is going to be more like your Crohn's, ulcerative colitis, step it up into kind of the autoimmunity realm. Now, there is IBD, there's IBS, and then we've got other conditions known as SIBO, and now recognized SIFO, that can mimic signs and symptoms, or really both of them. And so that's what we're going to be talking about here today, is going to be SIBO and SIFO. So what is it? What is SIFO? Let's start with that one. So SIFO is small intestinal fungal overgrowth. So we can have candida overgrowth or other type of yeast or fungal overgrowths within the small intestines that can give us a whole host of symptoms. In terms of SIBO, it's the opposite of fungal. It's bacterial overgrowth, so small intestinal bacteria overgrowth. So one's fungal-based, one's bacterial-based. They also can exhibit multiple signs and symptoms that are very similar to each other. Now, when it comes to these symptoms, I'm going to go through the whole host of them. When it comes to SIFO, you're typically going to have joint pain, you can have fatigue, you can have some headaches associated with that. And with a SIFO presentation, it's still going to be as though you have kind of a candida overgrowth. So if you run yourself a stool test analysis and we find out that we have a whole bunch of candida, well, it could be in the large intestines, yes, but it could also be housed in the small intestines there too. The good news for you is that if it does show up, and you have SIFO as well as just candida overgrowth in the large intestines, the treatment protocol is very similar for both. Okay, the dietary intervention, make sure we starve out the infection as well as treat it with natural herbs, natural agents. Okay. In the medical literature, they're talking about using things like nystatin to reduce fungal infections, fungal overgrowth. And to be honest, there is a time and a place for that. If candida has gone full out systemic through the body, sometimes we do need more of a heavy hitter like nystatin. But to be honest with you, I don't think I've ever had any patient need that. So the natural stuff works just as good, in my opinion. But that's just more for the sticklers. We're like, well, according to literature, it would say this. Well, I'm letting you know from my own clinical evidence and my own case studies and things that I've worked with patients, we haven't needed any of that. Okay. Now, when it comes to SIBO symptoms are going to be some that are even more prevalent. So we've got things like bloating that could take place, abdominal distention, right? So if you're eating a meal, especially high in carbohydrates, we get this giant bloating belly. Okay, so it could be SIBO. It could be like we talked about on our last podcast. It could be H. pylori that's found down there in the gut. But either way, it's a bacterial overgrowth, right? And so H. pylori can actually allow for SIBO and SIFO to occur. Right? So it's normally found bacteria that can sometimes migrate back and forth. The large intestine bacteria can actually crawl up and go into the small intestines, or the small intestinal bacteria can then overgrow themselves. There's a whole host of different scenarios that can happen when it comes to these particular cases. Now, the tough part is we've got the ab distension, we've got ab pain, we can get diarrhea, we can get fatigue and weakness. So the tough part is kind of differentiating between the two of them, right? And again, treatment protocol, again, fortunately for bacterial overgrowth as well as fungal overgrowth, is going to be very similar when we use these holistic agents, okay? Medicinally speaking, going to be different. You're going to use an antifungal versus an antibiotic, but from a holistic realm, these things are going to help to eliminate it. What makes it really difficult, though, is when it comes to diagnostic testing for these particular issues, especially SIFO, there's like really nothing you can do to test for SIFO. There's no like breath test you can do for fungal overgrowth within the small intestines. So it's going to be symptom based. It's going to be, you can find it on stool tests like the GI map. You'll see the candida overgrowth and certain markers that can go abnormal, such as H. pylori, elastase 1, sometimes steatocrit, opportunistic bacterial overgrowth. These types of things can sometimes hint, hey, there may be a SIBO or a SIFO presentation present, okay? The other things that makes these particular infections difficult is that they tend to have what are known as biofilms. So if you remember, it's those shells or those roofs or like shells that they have over top of them that make it really difficult to be detected, right? So when it comes to SIBO, typically people are going to go SIBO breath test, right? What I like to use, again, I'm not affiliated with these guys at all, and sometimes I'll use this, but I'll just use my stool test, the GI map, but you can get what's known as a food marble. So if you're watching this on YouTube, you can see this little itty bitty device. You basically breathe into it a certain time after you eat a meal, and it'll tell you, are you producing a ton of methane and sulfur? Okay, I believe those are two. Methane and sulfur, I believe, are the two gases that are going to be coming off that are going to get measured through there. Okay, so that'll let you know, hey, am I dealing with a SIBO or SIFO type presentation? In particular, weighing more towards SIBO. Okay, so the bacterial overgrowth, because the methanobacteriaceae, desulfibrio, those guys are going to increase sulfur and they're going to increase methane within the body. Okay, so when it comes to these types of diagnoses here, all right, so it is actually going to be methane and it's going to be hydrogen that the food marble is going to be testing you for. I apologize on that. So methane and hydrogen are going to be two gases that are going to be produced when we have bacterial overgrowth down in the small intestines. Okay. The thing that I am big with is it's great to know that we have a symptom and or condition, right? And it's great to know that we have bacterial overgrowth or fungal overgrowth. That's going to cause symptoms, right? So it's cause testing, but it's also symptom testing, especially with these guys. Why did these particular bacterias or fungal bodies overgrow? And so things that can happen, I mean, yes, we can talk about the standard American diet till we're blue in the face, but the standard American diet is going to be one of the main culprits for why we develop these particular conditions, right? Because if we have an infection, what are we told to do? We're told to treat it with antibiotics. That's one of the big causes of SIBO and SIFO. What about proton pump inhibitors, PPIs? Going to suppress stomach acid. If we do so, we go hypochlorhydric, which increases your risk for SIBO and SIFO, as well as H. pylori overgrowth, which is a bacteria which will also contribute to it. If you are on immunosuppressants, right? So if you're on cancer, if you have an autoimmunity, we'll see a lot of times we'll run stool tests on people with autoimmune disease and they're on an immunosuppressant and they still have infections, right? Because the warning is if new or worsening infections take place, contact your doctor. So you can have fungal overgrowth, you can have SIBO overgrowth. You can have issues where you have diabetes that can cause issues with SIBO and SIFO. You can have colectomies where you get pieces of the colon basically removed. And then again, dealing with that lack of stomach acid. So if you don't remember, gluten will cause a suppression of stomach acid. Stress, suppress stomach acid, right? Shoving down a bunch of food without being patient can suppress stomach acid and make digestion very difficult for you. Right? Lack of sleep can have an impact on it. Chronic stress can have an impact on it. You name it, and it's going to do it. So again, the standard American diet, the standard American society kind of pushes us in there. It's very difficult to find a person who doesn't have some form of an overgrowth within their body. The point is to catch it before you guys go medicinal, because once you go medicinal, you're always going to keep going back there. Just had a patient that reached out that was talking about amoxicillin. They got put on a round of amoxicillin to try to treat an infection, and then it didn't work. And then they're like, well, just take more amoxicillin for longer. And it's like, you're going to have new and worsening bowel issues. You may feel great while you're on it, but you just basically destroyed the good guys and you're going to allow for overgrowth of the bad guys. And that's where these commensal or opportunistic overgrowths take place. Okay? So again, with the fungal side of things, we can talk about symptoms, but it's not as easy to test as using the food marble for fungal overgrowth. So what do? Analyze as though you would analyze for yeast. Take a look at your tongue. So if you're looking at your tongue right now, and hopefully you're not driving doing this, but if you come to a stoplight, whip out that tongue, look in the rearview mirror, and assess it. What do you got going on there? Do you have a lot of white on the tongue? If so, that is confirmation of oral thrush. It's very difficult for you just to have candida localized in the large intestines. It's going to spread kind of everywhere. So it's going to go into the small intestine. It can go systemic, especially because it has this ability to increase gut permeability or lead to leaky gut, and then it gets carried the whole way throughout the body. So what are we looking for? So the tongue, we can look for toenail fungus. We can look for white spots on the fingernails, right? Toenail fungus is huge, right? Athlete's foot, another fungal overgrowth there too. And then if you have itching, whether that's vaginally or if that's just overall skin itchiness, this can be a sign and confirmation that you may have fungal overgrowth. Now, for those of you curious and you're like, well, I really want to see the evidence, we can test for these things on certain tests, right? So the GI map, the GI effects, those two tests, GI map is my bread and butter, it's my favorite, but you're going to be testing for candida, but it is still very difficult to find candida show up on those tests, right? Because once you take candida, or that's, really candida out of the stool sample, typically dies on contact as soon as it comes into our atmosphere. And then if that doesn't kill it, you drop it into preservation fluid and shake it up. If that doesn't kill it, you got to get to the lab. And if you do show positive for candida, that means you have a lot of it, and you have very resilient candida or just fungal overgrowth. It doesn't have to just be candida. It could be rhodotorula, right? It could be geotrichum. There's other versions of yeast that are out there. So when it comes to diagnoses, you can almost diagnose yourself with these things. Are you having horrible carb cravings that you can't quite quit? Are you having vaginal discharge? Do you have foul-smelling odor down there? Men and women. Men, do you have jock itch down there? Could be a sign of yeast or fungal overgrowth down there. So it's pretty easy to diagnose. It's just a matter of treating it. We'll get to the treatments here too, because I don't want to leave you guys just hanging like, well, what do I do now, right? So we can test for it on a GI map to see if you have candida overgrowth. But what I would typically be looking at is the tongue analysis, body analysis to see if you have symptoms of candida overgrowth. And then I would also be looking for issues with low stomach acid or other presentations that I would be able to see as a functional medicine practitioner. I'd be able to see patterns of analysis, say, hey, you have a bunch of hypochlorhydria, you have H. pylori, ton of opportunistic overgrowths. It's really difficult for you to have all of this and not have candida, because what this tells me is you're compromised. Your body has been compromised and the bad guys are taking over right now. So if you're like, can I test it? Yeah, kind of. Do a GI map. Jump into my lab shop and get a GI map and run one on yourself and see if some does show. In that too, make sure, again, you're analyzing the nails, analyzing your tongue, looking at vaginal discharge as well. Those are all signs and symptoms that you can have candida overgrowth. For the SIBO side of things, again, talking about the the bloating, etc. One of the things that I think is really important to know is these types of presentations, right? Hate prebiotics. Okay, they hate it. So if you find yourself as a person where you've heard Dave Asprey talk about this, and you've heard of all these other experts and holistic doctors and all this stuff, just take this shit, just take that, just take that, just take that, because they don't know what the hell they're doing. Yes, Dave Asprey, I'm calling you out. If you find yourself in a pattern of taking something that has been recommended for you, prebiotics, prime example, and you take it and you're like, oh my gosh, this is like, ooh, and it makes your body bloated, inflamed, right? Like inulin or some other form of like a prebiotic fiber, and you're like, oh God, it feels so bad right now. If you have that effect happen, especially if it happens multiple days in a row, then it's a sign that you have bacterial or fungal overgrowth, because those prebiotics are also going to feed the bad guys. And if they have already overgrown, you're just causing more growth. You're giving fertilizer to bad guys. Right, so that's why in functional medicine, we came up with this system where you have to remove first, replace things, and then go into the repopulate phase. Again, something that Dave Asprey apparently doesn't know about or doesn't particularly care about, because there's not as much money in fixing the cause versus taking 100 supplements a day like he brags about doing, which again, he looks worse than I think I've ever seen him look before in my life. Moving past that, enough with the hate on him. Biohacking is grinding my gears as of recent. And so moving on, SIBO, SIFO side of things, right? So what do we do with this stuff? You can get these diagnostic tests technically for SIFO. When it comes to SIBO, you can do a SIBO breath test. You can absolutely do that. It's a little bit more invasive. Or you can run a GI map and you look for certain bacteria that have overgrown. Again, if you have H. pylori that is present, if you have low elastase activity, or you have a lot of opportunistic infections, in particular Escherichia coli or Enterococcus or Klebsiella pneumonia or Proteus mirabilis. These ones are all bacteria that can overgrow and cause SIBO symptoms. On top of that, what else do we have? We have Methanobacteriaceae and desulfibrio, right? So these are going to either cause and contribute to SIBO or give symptoms of SIBO. methanobacteriaceae. Methane is going to produce methane gas, right? And then what else are we going to have? Desulfibrial sulfur. You're going to have very stinky gas. So if you see these two show up high on page, it should still be page 3 of the GI map. If you see it show up high, then you're like, oh my gosh, yeah, I have that particular presentation. So you would do a dysbiosis protocol or a SIBO, SIFO protocol, work to eliminate that, change the diet so you're not feeding it, and then work to replace the enzymes that you need and get after that repopulation phase, and then repair if there's any leaky gut damage, which 9 times out of 10, you're going to have if you've never worked on repairing your gut. Because if you have these infections, especially candida, it's going to rip apart the digestive tract and contribute to leaky gut. Okay. Now, what are some diets that you can do? All right, there are fad diets you can do, and I'm gonna poll on them. So you can do just a regular old anti-candida diet if you're working with candida or fungal overgrowth, which is just a high-fat, low-carb diet. So pretty much going keto. All right, and I don't necessarily like keto diets per se, but keto can be used for therapeutic purposes, right? So if we're depleting our carbohydrates to starve a bacteria, then we need to increase a macronutrient in fat so we have more calories to burn for energy. So you will go through the keto flu the first couple of weeks. You'll have the die-off of the candida and the bacteria as well. And as you're pushing towards keto, you're going to drop weight, you're going to feel better, you're going to function better, but then you have to cycle back in those carbs so you're not carb depleted for too long, especially for the women out there. You have to make sure that you're getting carbohydrates in so your thyroid does function properly and appropriately, okay? So dietarily speaking, do an anti-candida diet, dropping your sugars down, so carbs below like 60 grams, and then you can do just full-blown keto if you want to. You can track your ketone antibodies. Just know as you do that and you switch from carbs to fat, you're going to have that keto flu. It takes place typically within the first week or two of you doing it. You can use ketone strips where you urinate and test your ketones, see where you're at. But ultimately, that is something that you're going to need to do if you have some form of SIBO and or SIFO, which again, they usually grow together. In terms of agents to use, natural agents to use to reduce these infections, right? You can use a couple things. So you can use some berberine, right? Berberine is good at killing bacteria. It's good at replenishing your probiotics as well. It's good at balancing blood sugar too. And so a product I really love to use is called Berberine Synergy. It even has some lipoic acid in it, which will help with the adrenals and will help with blood sugar balancing. So there's a lot of benefit from taking berberine. After that, oil of oregano. So to me, you can do it orally where you do just oil of oregano drops right on the tongue, drink a little bit of water afterwards, or you can just do some tablets, little gel caps, drop them in, a couple of those a couple times a day, and that can help you to be able to reduce pretty much anything, right? So oregano is absolutely fantastic. It rivals amoxicillin because it kills more things and it hurts the body less, if that makes sense. So it's better, more effective, more efficient, better efficacy. You don't have to worry about the fallout of your probiotics completely getting wiped out as well. What else can you do? So there's a product from Designs for Health. It's going to be called GI Microbe X, which is a product you can take in higher doses. It can help with bacterial overgrowth in particular. It can help with candida too, but if we're working with candida or fungal overgrowth, I personally like a colloidal silver. So the product I use is silver psyllin, and you'll do like 2 tablespoons of that 3 times a day. Swish it around your mouth for about 30 seconds or so and swallow it down. Something massively beneficial and also highly overlooked is going to be your tongue scraping. So if you have any type of fungal overgrowth on your mouth, or if you find you get strep all the time, because strep is an oral infection, tongue scraping is something way back from like Ayurvedic traditional medicine. Like get that stuff in, get some tongue scrapers. We've got some, the kids have some. Scrape that tongue and clear that bacteria out. It will freshen your breath for obvious reasons, but it will also help to prevent you from swallowing down any more candida, yeast, or whatever that you may have in the mouth. So it'll help to protect it and also stop you from re-inoculating yourself or reabsorbing more of this particular type of infection, okay? From an overall standpoint, SIBO and SIFO is something that is growing to be more and more and more prevalent in our society. So we have to make sure that as individuals, again, I'm trying to give you as many tools as you can to work on fixing it and work on treating it. Okay, now I don't typically give like protocols out to, hey, just treat this, but this one in particular, I'm just going to tell you doses of it. And if you want to buy a protocol, go to my lab store or my supplement shop. You can order these yourself if you want to. But my protocols for SIBO and SIFO are typically as follows. So Berberine Synergy is going to be 2 pills 3 times a day. Oil of oregano, 2 pills 3 times a day. Okay, now if you're very sensitive to oregano, you're like, I can only do one, then do 1 pill 3 times a day. But you do want to get your dosing up there. Okay, GI microbex is 2 pills 3 times a day. A lot of 2s here. Then silvercillin, 2 tablespoons, swish it in the mouth for 30 seconds, but 2 tablespoons 3 times a day. Add in tongue scraping. And then if you want to get really fancy, you can get biofilm disruptors. Okay, and now this is something where you got to be careful because one of the best ones is N-acetylcysteine, so NAC. A little bit more difficult to find. You don't want to do too high of doses of it, otherwise it's going to rip your gut apart. So I don't necessarily recommend N-acetylcysteine unless I know what the gut looks like, but you can do like a C3 curcumin complex, 1 or 2 pills a day of that curcumin. You want to make sure that you actually have curcumin that doesn't have all these extra things added into it like berberine or black pepper, because you don't actually want it to be absorbed into the body. You'd rather have it stay in concentration in the gut and have, like, say you take 100 grams of it or 100 milligrams of it, 99 milligrams of it comes out in the stool. Like, that's what you want, because then that's going to help to kill the biofilms, break off the biofilms, and have a successful protocol for you. So 1 pill, a couple of pills a day will be beneficial to help with that. And also vitamin C. So like Stellar C is a product I use a lot. And you'd be 2 pills 3 times a day for that. And my people can put it in the show notes too, if you want. And my team can put all the links in there for you. Because I guarantee, at least 80% of the people listening to this podcast, especially if they're not under my care currently, are probably walking around with these particular infections. And we're not designed to. And if we allow this to happen long-term, we're going to have some serious long-term damage, right? Because what are we trained to do? If we have a symptom, we're trained to take a medication for it. So what if we do have bloating? Then somebody's going to give us a proton pump inhibitor. What if you have acid reflux? Proton pump inhibitor. What if we have H. pylori? Proton pump inhibitor. We may take some other supplements on top of it, Tums, antacids, etc. Now we're leading towards the path of dementia, right? What if you have constant candida and we're just bombing it with nystatin constantly, but we're not getting rid of the candida. We're making the microbiome far worse, which allows for more strong infections or stronger infections to take place within the gut. We can recirculate because that yeast is going to have more of a leaky gut type presentation. So every time we try to kill it, we're going to blast out more infections and we're going to be recirculating back into the bloodstream. But even more, in my opinion, more important than that, there's more and more research coming out that's talking about candida that goes systemic and it goes and attacks the brain. It goes across that blood-brain barrier, can lead to Alzheimer's, which we don't necessarily want to think about, especially if you're in your 30s, 40s, you don't want to think about going that route. But it is something that's highly prevalent in our society. It keeps getting worse. The other thing with candida, from a hormonal standpoint, both men and women, it's going to have an increase in our overall estrogen in our bodies. So estrogen is going to get worse. We can have more estrogen dominance. We can have more weight gain. We're going to have more cravings towards sweets. We're going to become more emotional. We're going to have blood sugar problems. We're going to have problems sleeping. And so we're basically building ourselves towards metabolic disease, towards cancer. So again, it may seem pretty harmless right now. Oh, it only happens every once in a while, but that's how it starts. It starts as only every once in a while, and then it gets worse. Then it gets worse, then it gets more consistent, then it gets harder to kill, then it gets more resilient, and then you're like, well, shit, what do I do, right? And then you're up shit creek, and you're like, how did I even get here? And so years and years and years of neglect allows us to go that way, right? So make sure that you're nurturing that microbiome. If you have any of those signs and symptoms that I talked about, then work on treating it, work on getting it back on track. But I do strongly recommend that anybody who does try the protocol, number one, contacts me to let me know that you did. And then if you want to, I would strongly recommend running a stool test analysis too to see, hey, how did this stuff overgrow to begin with? Yes, we have the diet, but do we have other things that we need to clean up to make sure that this result sticks and stays, right? Because we don't want to just continuously be treating every single year, treating the same thing over and over again. We want to make sure that we build our immunity up so that we don't have to suffer the same way that we have in the past. Okay, so remember, guys, never settle for normal and keep on searching for more and more ways to make your health better and making it easier. Really, just making it easier for you, but never settle for less than perfection.